It's no secret that if you take good care of your ticker, it'll take good care of you now and later in life. But there's so much information out there about good cholesterol and bad cholesterol. What does your blood pressure number mean? And is it ever too late to get Heart Smart? Dr. Ryan Shelton is a primary care physician with Tryon Medical Partners, and he's the top 5 things we need to know to be Heart Smart. Great to see you.
Good to see you guys as well.
And we're saying H-E-A.R.T, smart. The H, high cholesterol. Have at it, Doc. What do you want to tell us about that?
Cholesterol can be very complicated. It's a fat in the bloodstream. Our genetics play a large part, but so do our diet. The most important numbers to look at, we first look rather than at the total cholesterol, your LDL. So remember L for lousy. So that's the bad cholesterol. We do not want too much of that flowing through our arteries, so we want to try to keep that ideally less than 100. And then healthy cholesterol, HDL, H for healthy, that's the good one. So the higher the better for the healthy cholesterol. And that can help kind of counterbalance some of the risk from the lousy type cholesterol.
Well, let's talk about E, elevated blood pressure.
Yeah, we have to, as we age, our arteries become a bit more stiff. So our blood pressure can increase even despite having healthy weight, doing all the right things. So the top number for your blood pressure, we really want that 110s to 130s can be okay. It's the pressure that the heart has to pump oxygenated blood forward, like to pump against. So we want it to be able to, the heart's a muscle, so we want it to be able to pump forward against a lower pressure so it's not overworking too much. The bottom number is the pressure that your heart rests against, meaning when in between the squeeze, the heart relaxes, and that's when it refills with blood getting ready for the next squeeze. So we want it to be able to rest against a low pressure, so it's nice and chill when it's refilling with blood, getting ready to do its next thing.
This is very helpful. I'm understanding this in a whole new way. Okay, the A, attack symptoms. Knowing what they are?
Yeah, so we want you to never get to this point.
Right.
They can be somewhat subtle. So if it's chest pain associated with more winded, with exertion, jaw pain, nausea, it can be some vague symptoms can be different for women. But anytime you are having chest pain while you are exerting yourself, whether it's exercise or running in from outside to run up the stairs, if you have pain and some of those other symptoms with exertion, that is a major red flag and we need to be looking.
Can you take both R and T together?
Yeah. Risk factors, know your family history. Have people had heart attacks or strokes at a young age? Are they on cholesterol medicine or blood pressure medicine? Our genetics we can't totally change, right? So you have to ask your family, hey, what has happened with you guys and your parents and grandparents especially? And then the T is...
Talk to your doctor.
Talk to us.
Yeah.
Like get off Instagram and Facebook and everything that's selling you something, and let us help guide what makes sense to apply to you and your family history.
Tryon Medical Partners is always taking new patients too. You can go to their website, tryonmed.com. Dr. Ryan Shelton, so helpful. Thank you very much.
You're welcome.
Appreciate it.
Heart Smart.
Yes, be Heart Smart.